Add three more NBA players to the list of COVID-19 positive athletes. Two unidentified Los Angeles Lakers and Boston's Marcus Smart all have the virus. Smart tweeted he feels fine and stressed the importance of social distancing. And the NFL has its first known positive case. New Orleans Saints head coach Sean Payton. He's at home under quarantine.
And one of the biggest headlines this morning in the worldwide coronavirus pandemic is a possible new treatment using a decades-old anti-malaria drug.
But maybe not so fast. I spoke with Dr. Imran Ali, specialist in hospital medicine at the University of Connecticut Center on Aging. Dr. Ali, we know that a rush is on to find a vaccine, to find a drug that will treat coronavirus here. President Trump appeared to be pretty optimistic about the use of an anti-malaria drug in the fight against COVID-19. Will it help?
Well, hydroxychloroquine or chloroquine has been around since the 1950s, so we know it's been used for malaria. Malaria is a parasite, very different from a virus, but studies from China showed that it did reduce the ability of the coronavirus to enter cells. So the studies show some promise, but I don't know if it's ready for prime time yet. So it's not really FDA approved, but it may be providing some hope that it may be effective.
What do we know about the FDA-approved drugs like the one to fight Ebola that are being tested in this coronavirus fight?
Well, those drugs are still being tested with a control group and a group who is actually getting the drug, and we'll have the results by mid-April. But the thing is, these drugs all have side effects. So the biggest thing in medicine, first do no harm. We want to provide a treatment that's not going to cause more problems. So just giving this medication is a double-edged sword. It could provide some benefit, but there's always side effects that we have to be really careful about. Plus, these patients who already have pre-existing problems, this old drug from the 1950s has a lot of interactions with drugs that they may already be taking. So it's not just a silver bullet quite yet.
And your thoughts on the recommendation by a federal agency to possibly use bandanas?
A lot of my colleagues are shocked by that. You know, a bandana is not going to filter the viral particle. And when you have droplets, these droplets are not visible. They're really tiny. They can go through the bandana very easily. So it's not an effective thing. But people do say this is used as a last resort, because if you don't have anything else, you at least have some barrier protection.
We're also seeing more young people seemingly getting seriously ill in the U.S. compared to China. So what's happening here?
There's a lot of theories. You know, we're seeing up to 40% of hospitalizations with people between the ages of 20 and 54. So that was very different from what we saw in China. So the thing is, when you're young, you have a robust immune system. Now, if you go back to 1918, in the flu pandemic, most of the people who died were young people. And the theory is that, you know, although the virus can cause a lot of damage to old, frail lungs, it can also activate a hyperactive immune system, causing excessive inflammation. So the theory is these young people who have a primed immune system may actually having the immune system going into overdrive, causing severe inflammatory response, which can cause the difficulty in breathing, requiring oxygen, going to the hospital.
Thanks to Dr. Ali there.